Hey everybody, so I'm going to help you guys just understand and be more comfortable with chest tubes in the care of a chest tube patient. So what you'll first do is you need to get the supplies, and what you're going to need to get is a WaterSeal chest tube kit. This chest tube kit will have everything you need in it to hook the patient up to the actual chest tube itself after it's been inserted. Once you open that chest tube kit up, I know it looks like it's going to be like a sterile type of procedure. What you'll do is just you're going to open it up, usually tape the bottom, open up your actual kit, and then you are going to make sure, so when you will take your actual kit out, and it's going to look much like this. Now let's look at the different types of chambers that we're going to be monitoring as we take care of our patients with a chest tube, because monitoring of these chambers is going to help us understand and recognize if the patient's having any complications. So on the far left chamber over here, we have our suction control chamber. And in the suction control chamber, this is where you are going to instill sterile water to a certain prescribed level. And that prescribed level is normally at 20 centimeters per H2O, all right? That's the one where you'll be watching that, you're monitoring for that continuous gentle bubbling, and so on and so forth. The next chamber that you'd be watching and monitoring as you care for a patient with a chest tube is this second chamber here. The second chamber is the actual WaterSeal chamber. This is that chamber where you are going to be looking for that bubbling for your patient. You're going to be looking for either continuous bubbling, intermittent bubbling, and this is the one where you have to know what type of bubbling is the correct bubbling for your patient, all right? So this is where you'll look for that. This also, you see the little blue bubble right there? This is where you will normally see that tidling. So when that patient breathes in and out, it will go up and down, and you'll see tidling. And that's just the inspiration and the expiration of the patient when they're taking a breath, all right? Last chambers that you're going to look at is this big chamber over here. This is the big chamber that's going to be the collection chamber. This is where you will be monitoring your output from your patient. And remember, if it ever goes above 100 mLs over that 1 hour period, you're calling your doctor right away. Remember, continue to look at the consistency, the color, because you want to make sure you're monitoring for patients who may be having active hemorrhage, things like that going on. Okay, guys, so now we're going to go ahead and fill our actual chest tube container up with our sterile water. There will be a tube here that's connected that has our filter, that has our funnel, all right? This funnel is what's going to help us fill both of our chambers. We're going to be filling two chambers. We're going to be filling our suction control chamber, and then we are going to be filling our WaterSeal chamber. Those are the two chambers that we're going to be filling. So it's connected to the WaterSeal chamber, so we're going to do that one first, all right? So in the actual lecture today, we talked about kinking the tubing. Well, you can kink the tubing, or there's an actual stopcock here that's going to allow you to open it or close it, all right? So this is closed, so we're going to go ahead and do that first, all right? Open your sterile water. I'm going to fill up your funnel with your sterile water, and then you are going to open it up and then raise it until you get to that 2 centimeter line. All right, so we're at the 2 centimeters. That's what you're going to fill it to. All right, that's what you need to do right there. All right, now it's important to note this little stopcock. All right, once you fill this, you are going to make sure it stays like that. Okay, make sure it stays open. Don't ever touch it again. Don't ever touch it again. All right, now we're going to go ahead and take our funnel off. We're going to fill up our actual suction control chamber. All right, guys, so this is the one where we need to fill it up to that 20 centimeter level. All right, this is where we'll fill that one up. So we need to continue to fill this actual suction control chamber until it reaches that 20 centimeter mark. Boom, just like that. All right, there we go. It's like butter. Okay, now we have our stuff hooked up. We got our WaterSeals filled. Now it's time to watch our doctor put in that actual chest tube. Okay, so now it's about to get insertion time here, and so let's go over just like kind of what you're going to expect to see when they put in a chest tube. So when you put in a chest tube, it's going to come in a tray much like the previous tray that you saw. It's going to be all wrapped up, all right? And what it's going to be composed of is you've got lidocaine to help numb that area, all right? You've got the ChloraPrep, so it's either ChloraPrep or Betadine. It just depends on the manufacturer. We're normally seeing ChloraPrep now to clean the site. And then you're going to see different types of trocars. So these are the stylets they use to help open up that chest cavity. All right, there's different sizes, so we can start small and then get bigger up until we can even get this big, which is even larger than those other two. And that's just to open up that chest cavity so that we can insert the actual chest tube itself. Now, don't forget, you got to get some 4x4 gauze because you're going to need it. And then also that very, very important petroleum gauze that I talked about earlier today. And that petroleum gauze is what's going to help with any prevention of air leaks at the actual chest tube insertion site. Okay, so that's generally what you're going to see in the chest tube kit. You're also going to have a drape here. This is just a drape that you're going to drape over that patient so that you can keep the site as sterile and clean as possible. All right, so this is what we'll go over the patient and mark our area where we're going to be going. All right, so Mr. Williams, he's here, he's connected. We got his chest tube in. Now we got to get this thing moving and shaking, all right? So what we're gonna do is you got to have this connected to your wall suction. Your wall suction is usually here on the wall, all right? It's got two different things that we can use. You can either use an intermittent suction or a continuous suction. You need to put it on continuous suction. So you'll click the side that allows it to go on to continuous suction. Now, what that does after I turn that on, it will then make that suction control chamber bubble, all right? The bubbling is good in this chamber, all right? Now, I can go to this wall suction and I can make it go higher, you know, but the only thing that that does, guys, is that increases the rate of evaporation. It's no bueno. We don't want that to happen. So what I'm gonna do is I'm gonna have a nice little constant bubble like that, right? Nice constant bubble. And what makes it work, remember, what makes the suction work and the amount of pressure is that magic number you fill it to, all right? If you don't fill it to this number, then you're changing the pressure that's prescribed for the patient. It's not the wall suction that's creating the patient, it's the amount of water that you have in that suction control chamber. Now we got our water seal chamber, guys. Our water seal chamber is gonna tell us that a complication that can occur, and that's that air leak complication. So when we're looking at our water seal chamber and we come in to take care of our patient to look at it, we're looking at this little ball here. This little ball is the ball that's that tidalene ball that I told you about. That's going to happen. That's because the patient's breathing in and out, and just changing the pressures that are in the lung cavity. Now, if your patient has a newly inserted chest tube, we know there's going to be air in it, so there's going to be a noted bubbling over here, and this is going to be an air leak bubble, all right? The degree of bubble, there's these magic numbers 1, 2, 3, and 4, and 5. The more air leak you have, this bubble, this little ball here will go over to the different chamber and tell you the degree of air leak. Now, as the patient gets better and that pressure begins to normalize back to what it's supposed to be, that will go away. You don't want to see that actual bubbling anymore, all right? All right, so let's go through complications now. So one of the complications that can happen is that this, the water seal chamber, guess what? It doesn't work. All right, you walk into the room and guess what? There's no bubbling. What the heck's happening? So you go over to your wall suction, you check your wall suction, it's on. I don't know what's going on. So then go from the wall to the chamber and then make sure you don't have any kinks or it's not on the bed or whatever, and voila, it begins to bubble once again. Or remember what I told you at the very beginning, when you take your funnel and you fill everything up and you have to turn this to open the water back up, if you don't open it back up, guess what? You're not going to have any of that bubbling that you need to see. So, no tashi after you fill up your water seal. All right, guys, so now air leak. We're gonna do air leak from the actual chamber itself. All right, so sometimes, you know, well, it really doesn't happen, but it may, you never know, that this connecting tubing, so you know how we talked about tape, make sure your tape and your connections are always connected. Maybe this connection got disrupted. So when this gets clamped and pulled out, when it gets pushed and pulled out, look what happens down here, guys. You have that noted air leak that's occurring. That's not good. There's some type of air escaping into your patient. So make sure you check these connections and you get that back and sealed once again. So remember what I talked about today. Oh, well, what if it comes apart? What if it comes apart from the patient? To get that into sterile water, also, instead of reconnecting it, you can also put it in that sterile water until you can get a brand new tubing, because if that did fall on the floor, you need to get a brand new tubing set. Get that in the sterile water so that you can get that water seal resumed once again. All right, guys, so another complication, continue with air leaks, right? So I still have an air leak down there. It's showing me I still have an air leak. I looked here at my connector. My connector's connected. My connector's connected. So it's not that. So then now I've got to follow my patient. So I follow from my container to my patient, following. Hey, Mr. Williams, gonna take a look. Uh-oh, it's come out. So what do I do? I've got to get it covered as soon as possible. So always have this at the bedside. Have some 4x4 gauze, and then have a petroleum gauze, and then have some tape, all right? And what you'll do with the patient is this, is you're going to put the petroleum gauze first over the site. You're gonna put your petroleum gauze over your site. The chest tube insertion site, putting my petroleum gauze, all right? Got that there. And I'm gonna get my 4x4, I'm gonna put that over the top of that. And then what you'll do is you're going to make sure that you tape it. You're not gonna tape it on all 4 sides. No, don't tape it on all 4 sides. You're gonna tape it on 3 sides with the tape not being connected at the bottom. So you're gonna tape here, you're gonna tape at the top, and you're gonna tape at the other side, never at the bottom.